welcome back. I'm Mabel Jong, and I'm so pleased to have with me now Sara Stevens, who is VP Healthcare Economics and Analytics Ops at CDPHP. That stands for the Capital District
Physicians Health Plan in upstate New York.
Okay, great. Thank you, Sara. Sara, this is your first time attending HCEG. What are your impressions so far?
So far, it's been great. It's been an excellent opportunity for networking, really meeting with other executives from healthcare organizations who not only are not bored by what I do, which is a nice change of pace, but who really understand the challenges that we face in our industry and have insights on ways that they've tackled them, successes and lessons learned. So it's been very valuable.
Were there particular questions you had in mind before arriving at the summit that you hope you could discuss with members?
You know, I'm always interested in the technological advances, how people are using both from a telehealth standpoint, but also the data science. That's really where my passion is. So it was really interesting to go over to IBM Watson yesterday and tour their facility and get a sense of how IBM is utilizing augmented intelligence in healthcare and what we can sort of glean from their experiments as well.
Mm-hmm. What are some of the sessions you'll be attending that, or maybe you've already attended, that you feel will be useful in your work day to day?
Well, I have a passion for value-based reimbursement, so there's a session tomorrow in that area. So I'm looking forward to that. And the overview yesterday of how IBM is partnering with Medtronic to help patients with diabetes manage their disease was very insightful. So I think those are my top two so far.
Yeah, terrific. Did you get a chance to look at the top 10 list?
I did, and I think they nailed it. I mean, it really, every item on there would have been in the top of my list as well. Again, the analytics in healthcare is really my area, and I believe that was their very top of the list. The value-based reimbursement, the technology in healthcare and telehealth. I think that this group of people has really identified the top issues in the industry and gathered folks who are uniquely qualified to speak to them.
Yeah. There certainly is the data and analytics made the list twice in the number one spot. Have there been discussions where you work about the war of the clouds, perhaps, where all of this data is going into the clouds, who has access to it, who controls it? What is your thought on that?
So, I mean, being in a highly regulated industry with significant and important limitations on how data are accessed and utilized, it is always a challenge to really even just lay the infrastructure, lay the piping for ensuring that those connections are available and also secure. But once you get past that first step of how do we access these data, really the big question becomes, what do we do with them? We are no longer in a situation where we are yearning for data. We have ample data at our disposal. So figuring out ways to utilize that both in-house and then to deliver that to our constituents, our brokers, our members, our providers, is a large and exciting challenge to tackle in healthcare.
Right, great. And you'll be staying through tomorrow?
I will, yes.
What other sessions are you going to be looking forward to going to?
I'd have to actually look at the program.
But you've gotten a lot out of what you've seen so far.
I have. I'm looking forward even to today's lunch session to ranking the top 10 for next year, because healthcare is evolving. So it will be interesting to get some other takes on what will and won't shift out of those top. Always, the pharmacy trend is a hot topic, so I'm interested to hear that come up. But really, the entire program is informative. I'm looking forward to the whole thing.
Great. Thank you so much, Sarah. Really appreciate your time.
Thank you for having
Thank
me.
you.